Hi everyone, my name is Casey and I am the Director of Life Enrichment. Today we're going to be talking about resident rights, what our policy and our procedures are, and what exactly are resident rights. So first, what are resident rights? Our policy, along with the federal nursing home regulations, state that as a resident of Bethany, they have certain rights and protections under federal law that help ensure you get the care and services you need. You have the right to be informed, make your own decisions, and have your personal information kept private. So, do residents have the same rights as you and me? Of course. What if they have dementia and they don't really know what's going on around them? They still have the same rights. What if they have an activated power of attorney? They still have the same rights as us. What if they have a guardian? Of course, they still have the same rights as us. I always tell people this is the hardest part about our job is because we come into this field no matter what position that we're in is we want to care for people. So we want to help guide them into those decisions to make sure that they're making healthy choices. However, they still have the right to make bad and poor choices. So today what we're going to do is we're going to kind of talk through some of that. And I always tell people to make sure you stop and ask questions because it is kind of a sticky situation and we just have to all kind of talk it out. So never feel like it's a dumb question. So in 1987, the nursing home reform laws requires each nursing home to care for its residents in a manner that promotes and enhances the quality of life of each resident, ensuring dignity, choice, and self-determination. So what does this mean? Our residents come to Bethany because they require more assistance. And we know that with the aging process, they're going to decline in health and need more assistance. However, they should not decline in health because of the care that we are providing to them. So every resident that comes in, we provide to them this resident rights. So it goes through the types of resident rights that our residents have. But instead of going through this and talking through this, we are going to do a little kind of pop quiz, which is just a little different because obviously we're not face to face, but it still will kind of give you an idea. So, true or false, staff may open mail for a resident if they are in the hospital for an extended period of time. Don't do this. This is actually a federal offense if we open mail for people and without their knowledge. We do ask residents and their families when they come in if they would prefer us to keep some of their larger items, such as any medical bills or anything that comes from Social Security or Medicare or Medicaid. Because oftentimes they see things from the government and they're like, this is garbage, when in all reality, we do need it. So we do have that discussion upon admission, but we can't just unwillingly open that mail. We can open the mail if the resident asks us and they ask us to help them open it or read it to us. Absolutely, we want you guys to make sure that you're helping our residents with that, just because they might have difficulty with seeing things and reading and maybe even some dexterity within their hands. You don't have to knock when entering the resident's room. This is one of my largest pet peeves. I am that person that's going to follow behind you and knock on that door super loud. This is their home. Do you just randomly walk into someone's home without introducing yourself? So please make sure that you're introducing yourself and what your purpose is there. And even if they see you coming, please make sure that you knock on their door and you ask for or tell them what it is that you need or why you're there. Residents don't have to change their clothes every day. No, they don't. We want to obviously persuade them as much as we possibly can to get them to change their clothes. But if they want to wear dirty clothes, that's up to them. It's our job to explain to them the risks of not wearing clean clothes. But we also have to come that realize that this generation comes from a different time. A lot of them came from the Depression era where they really didn't have many different types of clothing and many available clothing at their disposal. So they didn't change their clothes. Plus, we also have to remember that they don't sweat like we do. They're not up doing too much. We do a lot of their nitty gritty hard work, I guess, every single day for them. So just because they're wearing the same pants 2 days in a row, that's really not that big of a deal. But obviously, yes, we want to influence them to change their clothing as much as possible. Residents cannot choose who cares for them, especially if we are short staffed. Technically, they can. They have the right to have who cares for them. This can be kind of a sticky situation, but one thing that we definitely stick by is if someone does not want a male caregiver, we are not going to be like, hey, this is who you have. You're stuck with a male caregiver. We really try to work with that. But if it's a conflict of personality or something, we really try to work with that individual. If that person is on the unit and they're the only person for a short period of time or whatnot, we do try to work with the resident, but sometimes they're still very adamant. I don't want that person to care for me. So we let them know that their call light time is going to be a little bit longer and they are going to have to just be patient until we can get another caregiver around to them. Residents cannot choose how their care plan is put together because we have certain rules and regulations that we need to follow. A care plan is how we care for the resident. So they should have 100% buy-in, and we have to put in our rules and our regulations into that care plan. But that care plan should be telling us how to care for that resident, and we really need to respect that as well. A resident wants to take a cab to go to the grocery store. Can you help set this up for them? Technically, yes, we should be helping them do that. Now, if there's someone with significant dementia and it's a safety risk, we want to try and discourage them to going on their own and maybe seeing if we can set up a time. But it might be a situation where staff have to follow them to wherever they are going, or you need to call family members. But technically, the only people that we cannot allow to leave this building is those who are protectively placed, if they want to go without some sort of assistance. Residents can be in other residents' rooms. Yeah, they can. This is their home. They can invite them in only if they really want them there. If they say, I don't want so and so in my room, we have to respect that. Plus, residents shouldn't be in other residents' rooms or in their living space when they're not there. What if we catch them hugging? That's okay. It's a hug. Sometimes people just need that, affection, and that's okay. But sometimes we want to make sure that we're really looking at, should we be watching this and should we be doing certain things? What if they are kissing? Well, this is something that the state is really honing in on, is sexual relationships among the elderly. So social services does do an assessment in the nursing home to see if someone is able to consent to treatment. So that is in their care plan. If it says yes, there's not much we can do. But if one person within that situation is a no, then we can intervene. However, in all situations, you need to make sure that social services is up to date. In the CBRF and the RCAC, you need to make sure that you're contacting myself and your director to let them know that you fear that there is a relationship going on. And then we will provide step-by-step steps for you to take and how to intervene if you need to in those situations. A resident does not have family and needs something from the store. I am going there after work and I will just pick it up and they can pay me back. Can I do this? Absolutely not. Please, please, please do not do this. This puts yourself in a situation. And I want you to think of it as, if you're going to do this for one resident, are you going to do this for all the residents here at Bethany? Because we cannot pick favoritism. So please make sure that if someone does need something, you're talking to either your director or social services, and there's means and ways that we can get around this to make sure that our people are getting the things that they need, whether it's ordering things online or maybe we do an activity run or something along those lines. A resident wants to call their son, but you are waiting for an important call back from the doctor. You can tell the resident that they cannot call right now, they need to wait. Again, this is their home. They have the right to make phone calls no matter what time of day it is. We do get families that are frustrated that are like, well, why are you letting my mom call? We technically cannot stop them. Plus, there are many phone lines here at Bethany, and there's different ways to get in. So we can always set that person up at a different phone to make a phone call. A resident was a housekeeper her entire life. She enjoys cleaning, so you give her a rag and let her clean off railings along with helping clean off tables after a meal. You are able to do this. Absolutely. We want them to feel like this is their home. Unfortunately, with federal laws, we still have to go back and clean that, but it still gives them a purpose and sense of worth to be able to do certain things. So please make sure that you're letting them help out with things that we allow them to help out with. A resident continues to fall out of their bed at night. You have put all interventions in place, but they still continue to fall. Family states that you can give them medication and or tie them to the bed because they gave permission you can do this. No matter under any circumstance, we cannot do this. This is against the law. So, sometimes it is, families think it's the easiest way, but unfortunately, people have the right to fall. They have the right to put themselves on the floor. They have the right to get hurt. It's our job to make sure that we're intervening and putting in all appropriate interventions to keep them safe. Residents cannot choose to refuse medications such as their insulin or heart medications. My biggest question to you is, do you follow what your doctor says to the T? Probably not. If not, I would. If I did, I probably wouldn't have a McDonald's Coke sitting on my desk right now. But we want to make sure that we're at least giving them the tools to understand if they do not take their medication, what is going to happen and what the consequences are going to be. A resident has an act A resident has an activated healthcare power of attorney. The resident does not want to go to their appointment and sleep. We can make the resident go to the appointment because they are activated. Unfortunately, we can't make the resident do anything. If they don't want to go to their appointment, they don't have to go to their appointment. We can't physically make them do anything. We have to remember they are adults, and adults have the right to make poor choices. Again, it's our job to point out the consequences of not going to that appointment, but we can't physically make them go to that appointment. A resident continues to say that they want to move to a different place. They are under a court order to live here. You have to help them look for a place because they want to. Technically, under a court order placement, we do not have to help them. During these situations, we would ask the court for some assistance. But anyone else, yeah, we should be helping them if they want to look at alternative placements, even in this situation. But it wouldn't be you, the floor staff, that would be doing that. It would be social services, and then maybe one of the directors in either the RCAC or CBRF, most likely with my help. So yes, we still have to help them, but sometimes it's completely out of our hands. A family states they do not want their mom on social media because they do not believe in it. The resident was involved in a group activity and is proud of it and wants everyone to see. They said it's okay to put them on social media. They are allowed to do this. they are allowed to do this, even if they have a healthcare power of attorney. This is not a healthcare need. This is just a personal social thing that residents have the right to say that. So just because one person doesn't believe in it doesn't mean that they can make the choice for their loved one. So a resident does have the ability to say, yeah, put me on social media. I think that'd be great. A resident states that they want a piece of cake. However, they are on a pureed diet. You make the pureed cake. However, they want the real thing. You give this to them because there is no waiver signed. Can they actually still have that regular cake? Yes, they can. The resident can say to us, I don't want that. I want something else. Again, our job is to identify the risk. In this situation, we would have a nurse come and identify that risk to them. And then we would put interventions in place so that if they were to begin to choke, we at least had someone near them. If this continued, we would then ask for a waiver to be put in place for these certain circumstances. And we do have quite a few residents that have done that. A resident wants to go to the emergency room because they do not feel good. You have tried to comfort them and done all the things. You call the POA and they say they do not want him sent. The resident continues to insist. You cannot send them because their POA is activated and makes health care decisions for them. Unfortunately, we still have to send them to the emergency room. It is what they want. The emergency room and the hospital have different rules and regulations than what we do, but in this situation, we really do need to send our resident to the emergency room because it is his request. What happens from there is kind of up to the hospital and the family. So we have to remember that residents are just like you and me. Though our jobs as caregivers and our first instinct is to care for the person, we need to remember that they too are adults and have the ability to make choices, whether we agree with them or not. Our job is to identify the risk, explain the risk, document the risk, and still ensure safety is in place. Thank you for listening, and if you have any questions, feel free to reach out to me. Thanks.